Good afternoon. We'll go ahead and begin with the processional of our PA students into the auditorium. My name is Dr. James Stallworth. I am the Medical Director of the USC School of Medicine Columbia Physician Assistant Program. And so I'd like to bid you good afternoon and, of course, welcome to this white coat ceremony for the Physician Assistant graduating class of 2023. The faculty, the staff, and I appreciate the presence of all of you, family, friends, significant others, and certainly the Dean at USC School of Medicine, Dean Les Hall, joining the students for today's ceremony. I want to back up just a little bit and give you some information regarding the white coat ceremony and the genesis of how the entire process kind of became part of a transition year or a transition ceremony for a year between the didactic year, which is your classic basic science year, if you will, to the clinical year, where the students actually go into clinical practice, have hands-on appreciation for dealing with the patients themselves. That does not mean there is not simulation prior to that time. But this is where they actually move from, so don't get too scared. Yes, but this is actually where they move from that didactic year to that clinical year. So if you look back at the white coat ceremony, it actually began in the late 1800s, and it began with the surgeons and then transitioned to the physicians and then transferred all the way up through other healthcare providers, obviously including the physician assistants nowadays. And the reason that it occurred was that back at that time, there were a lot of other people that kind of sold themselves as healthcare providers, kind of the magicians, the soothsayers, some of those kind of individuals. And of course, they all came out wearing their brightly colored, sparkled, sequins, whatever they wore, to kind of attract the attention and kind of became part and parcel to healthcare of that day. And so the surgeons decided they needed to separate themselves out from those individuals, meaning that the surgeons and physicians at the time wanted to be sure that the individuals understood that they practiced evidence-based medicine and they practiced scientific medicine, and they weren't kind of all involved in potions and all of those kind of things that were actually part of healthcare of that day. And so now, of course, this particular ceremony serves as a symbolic transition, as I mentioned, from the didactic year to the clinical year. And so the actual donning of the white coat represents professionalism, integrity, and the highest commitment of care for the sick and suffering. So with that as the introduction, I'll ask Hannah O'Quinn, class of 2023, who will lead us in the national anthem, and that will be followed by Professor Annette Rauch, who will be providing the invocation. Hannah.
Early stripes and bright stars through the perilous fight, o'er the ramparts we watched were so gallantly streaming, and the rockets' red glare, the bombs bursting in air, gave proof through the night that our flag was still there. Oh, say does the star-spangled banner yet wave o'er the land of the free and the home of the brave?
Thank you, Hannah. That was beautiful. All right. Let us take a moment to remember all the religions represented in the world by physician assistants. United in all faiths, we gather to introduce a new generation to our community in the name of education. A generation that has adapted rapidly to change and experienced untold obstacles as the result of the pandemic and international unrest before us. Please join me in reflection and appreciation with these words. With our friends beside us and no person below us, with the bonds of perseverance between us and our worries behind us, with our goals before us and no task beyond us, with a thirst for knowledge and a dream for a peaceful, disease-free world, we are thankful for the opportunity to provide this generation of physician assistants with their coat of armor, as they endure the values of life and learn how to exert their knowledge in service of healing of our community, one patient experience at a time. Thank you.
Good afternoon. Friends, family, faculty, and distinguished guests, welcome. I'm the class of 2023 student body president, and on behalf of all of my classmates, I want to thank each of you for attending our white coat ceremony today. This event is a culmination of a rigorous 15-month medical education that has challenged us all mentally, spiritually, and emotionally. We arrived on campus in early January 2021 in the midst of a global pandemic. I still remember that first day when I was sitting in a classroom in a room full of strangers, anxiously waiting for it all to begin, like it was yesterday. Yet, when you think of all that we've been through since that first day, it seems like a lifetime ago. I'm reminded of a quote that I first read in Dr. Paul Kalani's book, When Breath Becomes Air, where he describes his early medical education. In it, he said, "The days are long and the years are short." This quote perfectly summarizes what many of us have experienced. So if time is an unreliable metric, how do you best measure our journey so far? Do you measure it in PowerPoint presentations, in late nights and weekends spent in the library, or in tears cried? Or do you measure it in new friendships, personal growth, or concepts learned? Perhaps it can best be measured in minor obstacles overcome en route to our major goal. Our first class was anatomy with Dr. Blanc and Dr. Hallfield, where we learned seemingly every nerve, muscle, vessel, and bone in the body. And then we went to the cadaver lab, where we were able to see how it all fits together to make up the human body and learn more than we ever could from a book alone. We then took physiology with Dr. Marlene Wilson and the School of Medicine Physiology Department, where we learned how the processes in the body are supposed to work. Then we began our classes upstairs with the PA professors, Professor Dixon, Wilson, Ernst, Cranford, Rauch, and McCoy, where we learned medical interviewing, physical diagnosis, clinical medicine, medical ethics, and lab diagnostics. We also had the opportunity to have inspirational guest lecturers like Ms. Vicki Roberts, Mr. Phil Reith, and Dr. Stallworth, and many others. On behalf of my classmates, I wanted to thank each of you for your massive contribution, and I'm so grateful for your kindness, patience, guidance, and mentorship. I think I'm going to stop recapping here because I don't want to trigger my classmates' PTSD. But for the record, that was just our first 2 semesters. We had 2 more. My point is that the journey is long and the learning curve for working in healthcare is steep. And as difficult as it is being a PA student at the School of Medicine, being a medical educator is also difficult. On behalf of the class, I want to thank each of you who helped play a role in our journey. Over the next year, we're looking forward to working with Professor Myrick, Tracy Goldson, and Sherry Foxworth, who do so much of the behind-the-scenes work in getting our rotation scheduled and planned. We also want to thank Michelle Lasenga for planning this amazing ceremony and everything else you've done for us over the past year. Next, I wanted to thank our families and partners. I know that you guys probably felt our absence most acutely over the past year when we were focused on studying. I'm looking forward to making up lost time. We were only able to make it this far because of your love and support, including those who couldn't make it to the ceremony today but are watching at home. Lastly, I wanted to thank my classmates for creating an environment in which we learned with and from each other. Together, we've made memories that will last for a lifetime, from losing game after game in kickball, to celebrating birthdays, weddings, and babies, to consoling each other after an especially rough exam. We wouldn't have made it through this past year without each other. Now we enter the next phase of our journey. Wish us luck as we begin the hands-on part of our education, and we enter hospitals across the state to put our knowledge into practice. So this time next year, if all goes according to plan, I'll see you at graduation. I'm looking forward to it. I know all of my fellow classmates will succeed in whichever specialty they choose, but I hope, above all, we will always remember the impact that UofSC had on our careers. Thank you. I also have the privilege of introducing our next speaker, Dr. Les Hall. Dr. Hall joined the School of Medicine in February 2015. As Dean, he leads the Education, Research, and Clinical Mission for the University of South Carolina School of Medicine, including all academic and research programs, while also supporting the growth of undergraduate medical education. His academic work is focused on advancing interprofessional education, especially in areas of quality improvement, patient safety, and teamwork. Dr. Hall also serves as the Chief Academic Officer for Prisma Health Midlands, overseeing the training of our school's medical students and residents in more than 24 residency and fellowship programs. Ladies and gentlemen, Dr. Les Hall.
Thank you, Brian. It is such a pleasure to have a chance to join our PA class of 2023 here today, surrounded by our PA faculty and staff and so many family and friends who have all come together for this very special occasion. I love white coat ceremonies. They're among my favorite events in the academic year. They always take me back to my very first early days of training, prompting me to reflect on why I chose to become a health professional. All of our lives are punctuated by events that represent rites of passage, birthdays, commencements, weddings, many more occasions are significant changes or transitions that are occurring in our life journey. For our PA students today, this white coat ceremony is indeed a rite of passage, where you will, for the first time, officially wear the garment that has become the hallmark of the healing professions. And first and foremost, because of that, today's events reminds us that with the privilege of wearing this white coat comes a deep sense of responsibility to uphold the highest traditions of healers, providing care with compassion, always striving for clinical excellence, and working with integrity, and always putting the welfare of our patients first. When we begin our journey to train to be a health professional, usually the completion seems very, very far away. But today, as you don your white coats, you're one step closer to realizing your goal of becoming a health provider. And commencement will indeed come sooner than you think, and you will, following that, be joining the healthcare workforce, providing very much needed care for people that we live and work with every day within our our community. As we celebrate this important ideal of service through healthcare delivery, it is my great pleasure to introduce to you today our white coat ceremony speaker, Vicki Roberts. You've already heard that she's been a part of our program that has already made an impact on this class, and this will be yet one more contribution that she leaves with this class. Vicki Roberts graduated from the University of Florida in 1999 with a Master's in Physician Assistant Studies. Since then, she has been working as a dermatology PA at Palmetto Dermatology in West Columbia, where her clinical focus is general dermatology and surgery. She is a published author, and she has been frequently asked to speak at various dermatology conferences throughout the country. She's been an adjunct instructor at the UofSC School of Medicine PA program since 2016, so she's made this entire journey with us. She is a founding member of the Board of Trustees for the Dermatology PA Foundation. She has also volunteered her time in various positions, including serving as president of her state dermatology PA society and serving as the national president for the Society of Dermatology PAs. Please join me in welcoming Ms. Roberts to the podium to address the class.
I'm the only one that has a computer here, but you know. All right. Let's all hope it has enough power. Okay. Hi. So, hang on. Weirdness happening. Okay. All right, let's get going. So, hello, class of 2023. When I first agreed to speak today, I tried to remember what my white coat ceremony was like. I was having a hard time remembering at first, and I thought, well, Vicki, this was 24 years ago when you did this, so you're old, you can't remember. But then it occurred to me we don't actually have one. We didn't actually have one, believe it or not. You see, at UF at the time, it wasn't a thing for the PAs. My class just agreed to all bring our white coats in on the same day, go on the lawn. Someone took our picture, and that was it. And somehow I didn't even get that copy of a picture, so I have no recollection of this at all. So let's just say when I was asked to do this, I was like, I didn't even get one, now I have to speak at one? So, you know, at the end of all this, if somebody wants to put the coat on me, I'm not going to be opposed. So I might be in line there at the end, you know, because better late than never, right? Anyway, enough about me. Seriously, though, this is a huge deal. You should be so proud of yourselves for having made it through your didactic year. You have earned the white coat that will take you into your clinical year, followed by your actual careers. This is no small feat. I remember my didactic year like it was yesterday. It was so intense and stressful, just like Brian was mentioning. I remember talking to my other friends in their respective master's program complaining about the work they had to do. And I would scoff at them and say, look, I haven't slept in 3 days learning the inner workings of the immune system of the human body. I don't want to hear it. I don't mean to downplay other master's programs, and I'm sure there are some pretty difficult ones out there. But let's get real. Studying medicine is hard. Heck, we can't even work during our programs. There simply is no time. It is a full-time job with overtime. Now, even though you won't be getting paid in the traditional sense, you will become richer in knowledge. I know that it sounds corny and cliche, but it's so true. The reason studying medicine is so hard and stressful is because, yes, it's complicated. And there's so much to learn. But it's because we all know at the end of this educational journey, we will be treating human beings. They will be counting on us to help them. That is a huge responsibility. Knowing this, it is your responsibility to get paid in that knowledge with each and every one of your rotations. Now that you're starting your clinical year, you will be switching from the traditional classroom we've all become familiar with from kindergarten till now. Desks, chairs, papers, pencils, etc. To your future classroom of real patients, colleagues, clinics, and hospitals, practicing and honing those skills you have acquired this past year, especially the dermatology ones. Here's the thing. Get used to it. This will be your classroom for the rest of your career. This truly is the first day of the rest of your life. Not a week goes by in my 23 years as a PA that I do not continue to learn something new, whether it be from reading journals, attending conferences, or just from seeing my patients every single day. The moment you think you've learned it all is the moment you need to retire, because you will never learn it all. Not only is there an infinite amount of information to learn, it's a moving target. That information is always changing and being updated with new research and science. Understanding this as you head into your clinical rotations is key. My advice is this: enter each rotation with an open mind. You are a sponge right now, ready to absorb everything you can. Volunteer for as many things as you can. 1 month is really not a long time, and it will go by so very, very fast. With some rotations, you'll get all the experience you can handle, and with others, you may need to actively search for it. It might be helpful to learn these phrases. Can I watch? Will you teach me? Can I do that procedure while you watch me? Be brave. That does not mean you won't be scared or nervous, but you need to overcome those emotions and be brave. Your preceptors are there to guide you and help you through that process. Remember also that experience with procedures is not the only thing you'll be getting on these rotations. You'll be learning how experienced preceptors formulate differential diagnoses in the real world, how to succinctly pull a history from a rambling patient, how to explain side effects of a medication, how to deliver bad news to a patient. These are all things that are really hard to teach in the classroom. You just have to get out there, witness it, and do it. Another important piece of advice that I learned during my clinical year is that your preceptor is not the only person you can learn from on your rotation. You will be exposed to different people with different jobs in various settings. Respect them all. Learn from them all. I made it a point to learn the names of the nurses that worked around me in each rotation. I remember in my emergency medicine rotation in particular, I was taught how to get a quick urine sample with a catheter. During that rotation, I got pretty good at it, and I would offer up my services whenever the nurses needed that done. They loved the fact that I offered to help them and give them time to do some of their other tasks. And guess what? Whenever something cool came in the ER, they ran to get me so that I could see and learn something new. These interactions and relationships can make or break a rotation. Never think you're better than anyone else in that room, because in reality, you're not. You're just trained differently and have different skills. But everyone has a purpose. The sooner you realize that, the better your rotations will be, and honestly, the better your life will be. Remember that each rotation is like a month-long job interview. At the end of my clinical year, I actually had 3 or 4 job offers from the rotations that I did that year. You never know who has the ear of the person hiring. Treat everyone with equal respect. Now, as you all know, I've worked in dermatology my entire career, but I want to be very clear here. I have learned something from each and every one of my rotations and have used them in my specialty on a regular basis. This is why I mentioned you need to keep an open mind. If you go into a rotation in a specialty or field that you feel you will never do when you graduate, and tell yourself you just want to get through that rotation or any of the others that don't pertain to what you want to do, you will be hurting yourself. You will not become a well-rounded PA, and you will be doing all your future patients a disservice. Just remember, I too was once a green, inexperienced PA student heading off to my rotations. I remember how big our lab coat pockets had to be so we could stuff in all the little miniature medical books, charts, cheat sheets, medication guides. I'm surprised we could even walk with these coats. I mean, it was just insane. And then we'd have these lined index cards. We would write down, to present to our preceptor some patient we had worked up nervously. 42-year-old white female with history of diabetes presents today with, Now, everything's electronic and in an app, and you can pull information up in 2 seconds. I admit it's definitely better and more convenient. And I just realized I did the old person thing where, I went uphill both ways in the snow kind of scenario, but granted, it is better. Anyhow, I do have a suggestion. You may want to make a journal to capture important moments, sweet, sad, funny, that you'll want to remember. These are moments that affected you in some way during your rotation. They don't have to be about a disease or a treatment. just something human that you want to capture. All right, so for the rest of my talk, I'd like to share a few of my pearls of wisdom and journal-worthy moments. Preceptors will make you feel like an idiot. Understand, this is their job, to test you to your limits and force you to push yourself, find your weaknesses, and improve. The problem is some preceptors enjoy this a little too much. I actually remember a scenario during my very first clinical rotation, which happened to be OBGYN. My preceptor was not nice to his patients, staff, and especially not to me. I remember assisting in surgery where my job was to hold a laparoscopic camera while he worked on the patient. And I was quietly minding my own business, hoping and praying he forgot I was there. But no luck. All of a sudden, in the middle of the surgery, he pointed to an organ on the monitor and barked, "Vicky, what's that?" I was so nervous, and even though I did well in gross anatomy, I blurted out, "Kidney?" And he scoffed back, "No, liver." So guess who went home and studied her anatomy books all over again, determined never to make that mistake again? Patience will make you look like an idiot. This is not a matter of if it will happen, but when. More times than I can count, I would do a complete workup on a patient. Actually, as a side note, I don't know why a patient would ever be opposed to having a student work them up. You will never get a more attentive and thorough exam than someone that is learning. Students will do an entire exam, head to toe, working up a patient no matter what they're there for. They may wonder why you're using tuning forks to figure out their blood pressure, but what do they know? Anyway, so in this particular case, I do remember asking all my appropriate questions. Did you start a new medication? No. Have you had any recent illnesses? No. And so on and so forth. Then I presented all to my preceptor, like a pretty little bow package, you know. My preceptor walks into the room and asks the same exact questions, and the patient, as if they were out to sabotage me, suddenly remembered all the things they originally answered no to. I try not to bitterly glare at my patient, all while avoiding the disappointing side-eye my preceptor gave me as he continued on with the exam, assuming I didn't ask those questions ever. This will happen multiple times. Be prepared for it. Patience will also test your ability to keep a straight face. Remember, you will be seeing patients with different educational backgrounds. It is imperative that you learn a way to communicate with patients so that they understand what is going on with them and their bodies. Sometimes they may say something to us that sounds ridiculous and hilarious, but this is where you need to practice your straight face. Having to wear masks right now with COVID is actually very advantageous. Now, this may include the parents of those patients. In PA school, I had 2 pediatric rotations, an inpatient and an outpatient. My outpatient rotation was in a very, very rural part of Florida. I loved working with kids and making them laugh and feel at ease. So when I would do their well checks and start listening to their abdomen for GI sounds, I would start joking and pretend to hear what they had for breakfast. I would randomly pick breakfast food items. The kids loved it and giggled, and we moved on. But I clearly remember one day when I was doing what I do, and I was listening to this little kid's belly and said, "Wait a minute, do I hear a strawberry Pop-Tart in there?" And the kid just giggled away. And I happened to turn to look at the mom in the room, whose eyes were as wide as they could be, and asked, "Can you really hear that in there?" To which I had to suppress my giggle and say, "No, ma'am, just a lucky guess." Finally, experiences this year will change you. You will be dealing with real patients. You will be humbled. You will learn how fragile life is. No one is guaranteed tomorrow. One particular event happened on my ER rotation that I will never forget. I was working up a patient who came to the ER because earlier that day she was having some neurologic symptoms that worried her. And even though she wasn't currently having any of those symptoms, she wanted to be checked out. And in true PA student fashion, I was asking a million questions and doing a thorough exam. I was waiting for my attending to come examine the patient, but he was busy, so it was taking some time for him to get there. So I was able to get to know all about her family, her grandkids. She even asked questions about me. I really enjoyed talking to her and getting to know her. And then right before my eyes, she started mumbling incoherently, and before I knew it, she was unconscious. Of course, I ran to get everyone I could. She had a major stroke and never regained consciousness again. I watched this happen right in front of me. Although I was an inexperienced PA student, there really wasn't anything anyone could have done in that moment. Regardless, I felt helpless. this shook me to my core. And the fact I was the last person she had a conversation with really hit home. I tried to reassure myself that at least I was able to see her smile and proudly talk about her family and make her feel as good as she could during her last lucid moments in the hospital. As horrible as this experience has made me feel, I was certain that it has ultimately made me a better PA and hopefully a better human. Actually, all the experiences I have mentioned today and a million others have made me the PA I am today. I hope that in this crazy year you're about to have, you too will have experiences that make you study more, experiences that make you laugh more, experiences that make you cry more, and ultimately experiences that make you the best PAs you are meant to be. I will leave you with some words to summarize my advice to you. Pride. First and foremost, you need to be proud of yourselves for getting this far. Sponge. You are a sponge that is ready to soak up all that valuable knowledge. Respect. Respect everyone around you and treat everyone equally. And finally, be brave. Go out there and experience all you can. Do not be afraid or think you don't know enough, because honestly you don't. You never will. But don't let that stop you. You will only learn by doing things, making mistakes, and getting better. You've got this class of 2023. Good luck.
Thank you, Ms. Roberts. After that presentation, I want it to be noted, I am not an obstetrician, I'm a pediatrician. So just have to make that point. Professor Dixon.
That doesn't surprise me. He had to let it be known. All right. That was wonderful, Vicki. Thank you so much. All right. Well, we'll move along. We're going to do the PA oath. So students, you should have that in your program here. So I'll have you stand up. And you will recite after me. Okay? I pledge to perform the following duties with honesty and dedication as I begin my clinical responsibilities at the University of South Carolina School of Medicine. I will hold as my primary responsibility the health, safety, welfare, and dignity of all human beings.
I will hold as my primary responsibility the health, safety, welfare, and dignity of all human beings.
I will uphold the tenets of patient autonomy, beneficence, non-maleficence, and justice. I will recognize and promote the value of diversity. I will treat equally all persons who seek my care. I will hold in confidence the information shared in the course of practicing medicine. I will assess my personal capabilities and limitations, striving always to improve medical practice. I will actively seek to expand my knowledge and skills, keeping abreast of advances in medicine. I will work with other members of the healthcare team to provide compassionate and effective care of patients. I will use my knowledge and experience to contribute to an improved community. I will respect my professional relationship with the physician. I will share and expand knowledge within the profession. These duties are pledged with sincerity and upon my honor. Okay, I think you guys can have a seat and bring the faculty up on the stage. You don't have to. And present them.
Y'all ready? Hey, everyone. All right. Go ahead. I'm Lisa Myrick. I'm Director of Clinical Education here. We'll go ahead and get going. Hannah O'Quinn. Brian Bowman. Austin Belt. Emily K. Brown. Heather Bunch. Caroline Evelyn Calder. Catherine Frere. Melody Gappick. Nathan Hoadley. Paige Wilbanks Johnson. Emily Gray Grace Jordan. Caitlin Knight Duggan. Olivia Nicole Moore. Bailey Nestor. Priya Patel. Jennifer Ray. Coleman Ross. Hannah Bryan Simpson. Ethan Smallwood. Bailey Steele. Crystal Valente. Dana Watkins. Kara West. Nathan Williams. Sarah Woods. Samantha Younger. Eva Zaragoza. Congratulations, class of 2023.
Okay, guys, y'all did it. So, first of all, who knew how hard it was to put on a coat? Like, I have 3 kids. I should be a pro, but it was a challenge for some. Next year, we'll have a step stool for this route here. All right, so for some reason, they put the most long-winded faculty member in charge of closing remarks, so y'all know it's true. And I know everybody's ready to get out of here and go celebrate, so really, I'm going to try and keep it brief. First of all, and there's been many thanks to everybody here, but I really especially want to thank our wonderful administrative assistant, Michelle. I don't know where she is. There, oh, you're hiding over there, okay. So she pretty much single-handedly put this together, and I fear if she wasn't here, we wouldn't have a white coat ceremony. So we really, kudos to you. The students have something for you before you leave, okay? Second, just want to give a shout out to our faculty and staff, School of Medicine supporters, our community partners, our ambassadors. Yeah, there we go. All right. These people have put so many hours in behind the scenes to provide our students with the resources that they need to be successful, and truly, we couldn't do it without them. Next, I'm just thank everybody, okay? A message for the guests that the students brought today, those people who may be tuning in online. You really are the pillars that are holding our excellent students up. I know, like Brian said, there's probably been missed vacations and celebrations. Anytime a student asks us, is the schedule set? We always say, no, you are free on weekends. So, and it might not be easy for outsiders to understand, but you stood by and supported your loved ones without question and should be recognized for that. Give them a hand. All right, finally, to the students. You have just completed what you might consider the most challenging 15 months of your academic career. You have emerged victorious, maybe with a few battle scars, but you have successfully acquired the foundational knowledge and skills to be a great PA. This coat symbolizes something greater than that. It symbolizes the promise you made to patients to heal and to care for them. It's a symbol of compassion and professionalism. You have been entrusted with great responsibility, and not everybody is afforded that opportunity and honor. As you step into the clinical realm, wear your coat with pride and remember what it stands for. So with all that said, why don't y'all stand up, face your family. Congratulations, class of 2023. Thank you all for joining us today. There are cupcakes, water. Make sure you grab that on the way out. We'll let our students head out first. Yeah, students, there will be a picture here after. So.